Did you know that heart disease is one of the leading causes of death worldwide, yet many of its symptoms go unnoticed? That's because they often appear subtle, nonspecific, or even completely unrelated to the heart. This can make it challenging to recognize the warning signs before it's too late. Let's explore the signs you shouldn't ignore and how they may be telling you more about your heart health than you realize. The silent nature of heart disease. Heart disease is often referred to as a silent killer for a reason. Unlike more obvious health conditions, it doesn't always come with dramatic symptoms like sharp chest pain or breathlessness, especially in its early stages. Many people live with heart disease for years without knowing it because the body adapts to the slow decline in heart function. But subtle signs are often there, hidden in plain sight, and recognizing them could be your first step toward protecting your heart. Symptom 1: Unexplained fatigue. Let's start with fatigue, a symptom that's often overlooked or attributed to a busy lifestyle. While feeling tired is common, persistent or extreme fatigue that doesn't improve with rest could be a sign that your heart isn't pumping blood efficiently. This lack of oxygen-rich blood reaching your muscles and tissues can leave you feeling drained, even after a good night's sleep. If you notice this kind of fatigue, especially if it worsens during physical activity, it's worth discussing with your doctor. Symptom 2: Shortness of breath. Shortness of breath isn't just a sign of being out of shape. If climbing stairs, walking short distances, or even lying flat causes you to struggle for air, it could indicate heart disease. When the heart doesn't pump effectively, fluid can build up in the lungs, making it difficult to breathe. This is a symptom commonly linked to heart failure and should never be ignored. Symptom 3: Discomfort in the chest or upper body. Chest pain is a classic symptom of heart problems, but it doesn't always manifest as sharp, stabbing pain. Instead, it may feel like pressure, tightness, or discomfort that comes and goes. Sometimes, this pain radiates to the shoulders, neck, jaw, or even the back. Did you know that digestive symptoms can be a red flag for heart issues? Persistent indigestion, nausea, or stomach pain, especially when accompanied by other symptoms like shortness of breath or fatigue, could indicate a heart problem. This is because the heart and digestive system share nerve pathways, and heart issues can sometimes mimic gastrointestinal discomfort. Symptom 5: Swelling in the legs, ankles, or feet. If you've noticed swelling in your lower extremities that doesn't seem to go away, it could be a sign of heart failure. When the heart isn't pumping blood effectively, fluid can build up in the body, leading to edema. This swelling is often more noticeable at the end of the day or after prolonged sitting or standing. Symptom 6: Irregular heartbeat or palpitations. Feeling like your heart is racing, skipping beats, or fluttering can be another hidden symptom of heart disease. While occasional palpitations are usually harmless, frequent or severe irregularities could indicate conditions like atrial fibrillation, which increases the risk of stroke and heart failure. Symptom 7: Excessive sweating. Breaking out in a cold sweat, especially without exertion, is another symptom that can point to heart problems. It may be the body's way of compensating for reduced blood flow due to a struggling heart. If this happens alongside other symptoms like chest discomfort or shortness of breath, it's critical to seek medical attention immediately. Symptom 8: Dizziness or lightheadedness. Feeling dizzy or lightheaded can happen for many reasons, but it's also a potential sign of poor blood flow to the brain, which may result from a weak heart. If this symptom occurs frequently or leads to fainting, it should be taken seriously. Symptom 9: Persistent cough. A lingering cough, especially one that produces white or pink mucus, can be a symptom of heart failure. This happens when fluid accumulates in the lungs, causing irritation and a chronic cough. While this is less common, it's still worth noting if it occurs alongside other symptoms. Symptom 10: Sleep apnea. Sleep apnea isn't just a sleep disorder, it's also closely linked to heart disease. People with obstructive sleep apnea often stop breathing briefly during sleep, putting extra stress on the heart. Over time, this can lead to high blood pressure, arrhythmias, and other cardiovascular issues. If you or a loved one are experiencing any of these symptoms, don't ignore them. Early intervention can save lives. Thank you for watching. If you found this video helpful, please like, subscribe, and share. And as always, take care of your heart, it's the engine that keeps you going. See you in the next video.